Vinaka and Namaste. You're watching Fiji Village Straight Talk. I'm Vijay Narayan. Our guest tonight is Dr. Jason Mitchell. He's the chairperson of Fiji's National HIV Outbreak and Cluster Response Taskforce, an important initiative now being taken to deal with this issue. Some are calling it a crisis that we need to quickly act on, and we need to act on it fast. Dr. Mitchell has described the situation as a concentrated epidemic that's heading towards becoming generalized in our country. Last year alone, nearly 1,600 new HIV cases were recorded. That's a huge jump compared to just a few years ago. Let's start with how serious this is really in Fiji. Dr. Mitchell, thank you very much for accepting our invitation to come on the show tonight.
Thank you, Vijay. Happy to be here.
Now, what does it really mean in real terms when you say Fiji is heading towards a generalized epidemic?
So in the HIV world, the UNAIDS classifies HIV epidemics in three sort of categories. The first one is a low prevalence sort of epidemic. It's where Fiji was a number of years ago. And that's when you have a prevalence of less than 1% of HIV in the general population. We classify general populations, our measure are antenatal women, so women who are pregnant, who are attending hospital. So if you have a prevalence of less than 1% in the antenatal population, we consider that a low prevalence epidemic. A concentrated epidemic is when you have a prevalence of HIV of more than 5% in key population groups. Traditionally, these key population groups are men who have sex with men, sex workers, and transgender populations. So if you have a situation where you have over 5% concentrated epidemic plus a generalized epidemic which is more than 1% in the general population, then we consider that a generalized epidemic. And examples of concentrated epidemics is where you will see it in Southeast Asia, for example, where the majority of infections might be with drug users or men who have sex with men and sex worker populations. A generalized epidemic is the kind of epidemic you would see in sub-Saharan Africa. So that's why I think it's for us to understand that's the direction we're heading, which means that very soon 1% of our women who are pregnant will have HIV. And when you think of other diseases, 1% seems like a very low number, but in the HIV world, that is a significant number. Last year we were close to 9%, 0.9%, which means we are heading in the direction of a generalized epidemic, because we are already seeing over 5% of our key population groups now have HIV. And in Fiji, our key population groups right now are men who have sex with men, sex workers, and also people who inject drugs, who is a new population group that we're needing to work with here in Fiji.
But it doesn't mean that heterosexual partners are not also having HIV, right?
Yeah, so traditionally in Fiji and across the Pacific, unlike other parts of this region, all our infections were in fact in the heterosexual population. It was unusual for us to have high rates of HIV in MSM or men who have sex with men, sex workers and transgender populations, which is what you see in places like Australia or in Southeast Asia. In the Pacific, all our infections were in heterosexual populations. That's changed very rapidly. So when I first started with my work here in Fiji in October last year, it looked like we were having a concentrated epidemic. So when we started to look at the numbers early on this year, in the first quarter of this year, I started to get more information from our clinics, and it was looking more and more like we were heading towards a generalized epidemic. So we've shifted very quickly from a heterosexual focused infection to groups of infections in key population groups, and now it's like everyone in the country is at risk of HIV now. And our data is showing that. Historically, most of our infections were mainly in the cities. We are picking up infections right across the country now. And these are in people who are considered low-risk population groups, which is why we are saying we're heading towards a generalized epidemic.
It's concerning that it's going widespread.
Mm-hmm.
And what are the ages? What's the youngest age of a person who's got HIV, the numbers that you're getting?
Yeah. I think let's start with the youngest group of people who are infected. The reason why we are saying that there's a serious concern that it's a generalized epidemic is because last year alone we had 32 babies who were born with HIV. And this means that women who are pregnant. A lot of them are either HIV when they become pregnant, or they become HIV infected during the course of their pregnancy, or after delivery, shortly thereafter. They are able to transmit HIV through breast milk. So 32 babies were born last year with HIV. Now, when you think about, like I said, other disease areas, you think 32 doesn't seem like a large number. But to give you some context, for the last 20 years, New Zealand has had only one case of mother-to-child transmissions of HIV, which means that 32 for Fiji is a really, really large number. So that's for the very young who are infected. Now, people who are older, from the ages of 5, we're starting to report people who are diagnosed with HIV. And in the last, compared to the last 3 years, between the ages of 10 and 19, so our adolescents, we've had a 45-fold increase in adolescents who are becoming infected with HIV. And this is not as a result of sexual transmission. It's all as a result of the high-risk practices that are associated with intravenous drug use. So drug use is something that is not only being used in older populations, but also our young populations.
And when you're saying that age group, what age group is that? The one that's using it through injectable drug use and getting HIV?
So from the ages of 10 upwards, these are people who are using drugs, as far as our data can show.
Dr. Mitchell, some doctors have stated that the situation is really bad now, with many cases emerging. What are your comments on this? How bad is it out there on the ground? The people of Fiji are watching tonight to sort of get a real picture of what's happening on the ground.
I think the way that the government has positioned its understanding of the HIV situation is really, I think we can look at it in a number of ways. HIV often leads to a reduction in your immune system's ability to fight off diseases. And as a result of that, many other infections that would normally not infect someone would suddenly be on the increase. And so many of our doctors in the hospital are seeing what we call a number of opportunistic infections being presented to the hospital, which means that infections that would not normally be in our population are now being present in our population. A good example of this would be TB. TB is now under a lot of pressure, the TB program. The TB program, as a result of the large number of HIV people who are becoming infected, they are suddenly presenting to the hospital with TB infections. And at one point in time, 80% of all infections in the TB hospital will be TB-HIV co-infected, which means they have both infections at the same time. So that's the TB program. We all know that a number of media reports have talked about the number of people who are HIV positive who are also presented at St. Giles, which is our psychiatric hospital here in Fiji. There's an increase in number of people who, as a result of drugs, who are presenting to hospital because of psychosis or mental health issues as associated with drugs, are reported to be HIV positive as well. So that's the psychiatric hospital. Then, of course, our HIV clinics are overwhelmed with HIV cases because for the first time we've had so many people pouring into the clinics, and the clinics don't have enough staff, and so they're feeling very overwhelmed by the number of cases that they're seeing. And of course, our tertiary hospitals, where all the major hospitals in the country are overwhelmed with people who are co-infected with other infections, who are presenting with infections. And that's where their concern from doctors are coming from.
We've seen new cases double year after year since 2021. What are the latest statistics? Do we expect the major increases to continue?
From what we can see so far, I think the pattern will continue this year, where we're seeing a doubling of infections. Again, I think it's good that you've pointed out that there's been a pattern over the years, a doubling of cases. So we expect that to be the case. We expect, as we improve in our outreach work, we improve in our testing, that this will continue for a number of years. And that will be because two things: an improvement in our programming, which means we're reaching out to more people and testing the right people, and therefore we're reporting a lot more. But at some point in time, we expect the numbers to go down, and that's what our goal is, to bring the numbers down.
I think the red flag is up when you're saying that now you're seeing the increased use of injectable drugs and amongst even the young population, and people may have been thinking, oh, okay, this is the older age group, and we're going right down to even 10-year-olds and up.
Yes.
If this trend continues, where do we see us in the next 3 to 5 years, Doc?
So in the HIV world, we work a lot with mathematical calculations, what we call estimates, and we are able to project what things will look like if we don't introduce certain interventions. And UNAIDS did an exercise for us late last year, and they were able to identify that because of intravenous drug use and because of the high-risk sexual practices in our population, if we don't introduce very high-impact prevention interventions, in the next 4 years we will have 25,000 people in this country who will be HIV infected. And to give you some context and some background to why that's alarming is that right now, based on our current estimates, we expect Fiji should have 7,000 people living with HIV. So for it to go from 7,000 to 25,000, that's a huge jump. So it's a real concern for us from the ministry, and of course we're doing as much as we can to make sure that doesn't happen. So the introduction of high-impact prevention interventions is a key priority for the task force.
More than 90% of last year's cases were among I-Taukei. I just want to ask, why is this group being hit so hard? Is it being more I-Taukei coming out because more I-Taukei are coming out and getting tested?
That's most likely to be one of the reasons. The other reasons is we target a lot of community groups based by ethnic groups. We do a lot of targeted interventions, like it's just a practice in public health here in Fiji. But also we're starting to recognize that in many of our key population groups, a lot of our populations that belong to these groups are actually people who are I-Taukei, and therefore they're engaged in high-risk behavior. Why that is, we don't know. We don't have the data. We haven't had the research around any of that. But the good news is there's a lot of research being done now that should answer a number of these questions that we just don't have answers for. We don't have, to be honest, I don't think anyone can say for sure why the I-Taukei population is actually impacted by HIV more than other population groups. But just to be clear, all population groups in this country are reporting significant increases in HIV. And so therefore, for us to say that it's just an infection that is impacting the I-Taukei population would be a misguided understanding of the situation. And I think it's important for us to reflect that HIV infections are increasing in all population groups in this country.
Just more of it is because maybe the population group is much higher.
That's true. I mean, the majority of our population here are I-Taukei. Before 1987, the majority of our population here were Fijians of Indian descent. It's completely changed now. So of course you've got a higher proportion of people here who are I-Taukei. That must also be something that you need to factor into your understanding of the data around all of this.
And for the Indo-Fijian community and others, of course, we're seeing that there are also increases, although it won't show at that level of percentage because of the population mix again, with the I-Taukei population being the highest in Fiji. The messaging of it between I-Taukei, the Indo-Fijian, and of course the other minority groups. Are plans underway to intensify this?
There is. I think one of the challenges that I've noted in the previous response to HIV here is the focus on generalized awareness. In other words, trying to cover as much of the population as possible. Effective HIV responses require targeted approaches. And so what we're looking at is looking at messages that target groups that have known specific risk factors and providing them with the right messaging so that they understand whatever risk practices that they are undertaking, how that might lead to HIV and other bloodborne viruses, which is something that hasn't been covered by the media. But because of the various risk factors in our population, with significant increases in hepatitis C in the country, also other bloodborne viruses that are associated with blood sharing that is common amongst people who inject drugs.
And just connected issue, one of the most dangerous combinations today in Fiji, hard drug use, as you've confirmed, group injecting, Bluetoothing we're calling it, and then unprotected sex. How much of Fiji's HIV spike can be traced back to that?
Yeah, I think it's very, very simply, there's three risk factors that we identify now in Fiji, to keep it very simple. There is those of our traditional way of becoming infected with HIV, which is high-risk sexual practices that lead to HIV infection, and then there's now intravenous drug use or the risky behavior that is associated with this drug use. I think it's important for us to be clear that drug use in itself does not lead to HIV. It is the practices that are associated with drug use. And for our unit, the SRH and HIV unit and the Taskforce, it's important that we distinguish between the two groups. But also to understand that there is the third group, which is vertical transmissions or infections that go from parents to their child. And so these are the three major groups. There are close intersections between both groups. So people who are engaged in high-risk sexual practices are also engaged in high-risk intravenous drug use. And the two happening together results in increasing risks of HIV, STIs, and blood-borne virus. And that's currently the challenge we need to deal with.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break. 20 years ago, we had a major drug bust, and you would remember, you would have been part of the operations at Laudala Beach. A lot of people in Fiji did not know what was methamphetamine. And what we are picking up on, people are saying it's readily available. Just the issue in relation to General Secretary, was that a tactical move that he ejected himself from Parliament?
Personally, it's unfortunate.
How are you dealing with those police officers who may be allegedly involved in this?
Vijay, no one is above the law.
We assure you that we will be having police officers around.
As a result of that bad policy, by the end of this month, we would have lost close to about $70 million in government revenue.
Bula Vinaka, I am Vijay Narayan. This is Fiji Village Straight Talk.
Fiji Village Straight Talk with Vijay Narayan. Watch it live on the Fiji Village Facebook page and YouTube channel.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. Our guest tonight, Dr. Jason Mitchell, the chairperson of Fiji's National HIV Outbreak and Cluster Response Task Force. And Dr. Mitchell, when we talk about HIV, we often focus on statistics. But behind every case, there's a person, there's a family, there's children involved. Let's talk about the reality of what happens when someone tests positive in Fiji today. When someone is diagnosed, what kind of care and support do they actually get here in Fiji?
Thank you, Vijay. I think it's great that we're reflecting on this, because I think one of the things that we need to appreciate is that a diagnosis of HIV creates a lot of challenges for individuals and their families. There's a lot of stigma and discrimination around a diagnosis of HIV. And oftentimes the immediate thing that a person might need to deal with is, who do I tell? Who can I tell? Who can I safely share this piece of information with? And a lot of the times they end up sharing it with no one. And that leaves them often unsupported and alone. And we are Pacific Islanders, we are oceanic people, and we are collectives. And if we aren't able to deal with what we're dealing with as a part of a larger group, it becomes very difficult for us. And that leads to a lot of challenges with treatment and care. There's no cure for HIV, but there's treatment available, and it's a manageable disease like diabetes and hypertension. It's the same approach. You need to be on treatment for life, but it requires a lot of support from loved ones, from family, from your workplace, from your church, from the vanua. All of those things are essential factors of how treatment can be successful. So when someone is diagnosed with HIV here in Fiji, the only place that they can get treatment and care right now is in the 3 HIV clinics that are spotted around the country. There's one in Suva, Lautoka, and Lambasa. Those treatment clinics provide treatment free of charge, which is covered by the Fiji government. But again, treatment requires a lot of support around it, and we still have a lot of challenges around that. One of the things that we need to address is the psychosocial support that is required, so that people feel supported and cared for the rest of their life. We are human beings, we don't live in vacuums, and so sometimes when other things in our life are impacted, it affects the success of treatment. People don't just get HIV, they get every other kind of infection, they will get hypertension, they will still have their heart problems, they will still get a stroke. all those things are still there. So it's a lot for people to deal with. So HIV is one of those infections that impact communities. And the situation that we're having in Fiji is that families are becoming infected with HIV, parents are becoming infected, their children are becoming infected, and it's something that we never imagined in our lifetime that we'll be needing to deal with. But this is where we are here in Fiji. So the support that is needed for families and for individuals is immense. We're still grappling with how we're going to implement that and how we're going to introduce that, but it's something that we are very challenged by, and we feel positive that there is sufficient support within our government and around us through our NGO partners and our communities to make that happen. It's going to be a long road ahead of us, but there's a lot of great people behind the scenes doing as much as they can to make this happen for people who are infected with HIV.
Do HIV survivors and even children of those HIV positive parents face stigma or discrimination in the community? Are you getting feedback from the ground in relation to that?
Yes. Unfortunately, stigma and discrimination is not something that's in our past. I've been around long and worked in HIV in Fiji some 20 years ago. The same stigma and discrimination that our communities faced back then is present now. In fact, I think, and I don't have enough data or any research to back this up, but I feel that stigma and discrimination somehow is more intense right now. And I think a lot of it has to do with the attachment of HIV with drug use and how drug use has become a central point of discussion in our community, in the media. And that automatically creates a lot more stigma around it, because suddenly if you are somebody that's HIV infected, somehow you're a drug user as well. That's not always the case. Half of the people who are infected with HIV got HIV some other way. And so therefore a lot of the stigma is misplaced. There's no need for stigma and discrimination in this day and age, and it's something that we need to address. And unfortunately there is so much stigma and discrimination that needs to be dealt with. We still need to figure out a package of what we need to be doing to address a lot of the stigma and discrimination that exists throughout our society.
And some still believe that HIV diagnosis is a death sentence. How much has treatment changed life expectancy and quality of life today?
Yeah. As I said, I've been working in HIV from the early days of the epidemic when it first arrived here in Fiji. And in the early days, there was no treatment for HIV, and people were becoming diagnosed with HIV, and not long after that, they would die. Treatment has changed significantly the outcome for the people who are infected with HIV. Many of the people I first diagnosed with HIV are still alive today. In fact, if they are dealing with anything really, they're dealing with something else that's a health issue. It's not HIV, because the HIV is well managed. Unfortunately, it requires that people are put on treatment and stay on treatment. And those who are not on treatment and those who drop out of treatment are the ones who are now coming in very sick into our hospitals and the ones who are actually dying for HIV. HIV deaths last year were 126. Again, in the context of other deaths in other disease areas, that's a small number. But for HIV, it's inexcusable because we have treatment. So we really should have 0 deaths associated with HIV. And I think I want to draw on the global goal for us, and that is 0 new HIV infections, 0 AIDS-related deaths, and 0 discrimination. That's the global goal. And we're heading towards achieving that in Fiji, and that's something we should all be working towards together as a community.
Availability of drugs, medication. The people need antiretroviral drugs.
Yes.
Is that readily available? Is it always in supply? Are we facing issues in relation to that?
I think we all remember the media coverage of the stockout issues we had in the last couple of months. This hopefully is an issue of the past. The government had made some brilliant decisions around that, and one of the most important ones there is to outsource the procurement of HIV treatment and TB treatment and diagnostics to the UN system. So currently there is a contract between the Fiji government and the UNDP, who is using their global procurement to make sure that our stocks of drugs is always available in the country. I'm not saying that we're not going to have a stockout issues. There's going to be lots of teething around us addressing all these procurement issues we've had in the past. And We are hoping that we don't have any stockouts, but it's always something that we're paying very close attention to. In fact, we have regular meetings with our procurement committee, making sure that there's any issues around stockouts is addressed early rather than later.
Concerns have been raised on the ground about lack of testing facilities. What are you facing in this regard? And how is the Ministry of Health coping with tests and equipment?
Yeah. So in terms of test kits, I think it's important that to appreciate there's different types of test kits that we use. The first one obviously is the test kits we use to diagnose someone with HIV. And in the media in the past, that was a common stockout issue we used to have. So far, with the support we're getting from our partners in the UN system and DFAT and other partners, we don't have any stockout issues on the horizon right now for HIV diagnostics. So this is the test kits that we use to diagnose someone with HIV. We also use test kits to help us monitor people who are on treatment. Currently, we don't have any stockout issues there, but that's always something we're always concerned about. We had a meeting before I came down this morning to join you in this interview, and we're looking to see what our stock issues are around what we call viral load test kits. We want to make sure we don't have any stockouts because they're an essential element to making sure people are successful with treatment. And so we're making sure that our stocks are okay. And if there's going to be any issues, we'll look at emergency procuring additional stock kits.
The risky behavior surrounding the increase in the statistics is staring right into our faces.
Yes.
And in terms of risk management, we expect the blowout to continue, the number of increased cases of HIV. Are we forward planning as well in terms of our infrastructure, our testing equipment, and as you said, with the medication to ensure we're ready for it?
Yeah, so in terms of preparing for the work that needs to be done in terms of prevention and treatment, we have a committee that's been established under the Taskforce that looks at procurement and supply chain. And we've gone through a couple of months exercise of looking at the number of people we expect to be diagnosed with HIV, so making sure there's enough test kits for diagnosing them, making sure there's enough treatment being ordered, antiretrovirals, and also making sure that we also are ensuring that the TB program is well resourced in terms of any test kits that they need, also any treatment for the TB program, because they're having a lot of TB cases diagnosed because of the number of HIV people being infected. We also are looking at improving our prevention, and one of the things that the government is spearheading is the introduction of a needle and syringe program, also the introduction of pre-exposure prophylaxis and strengthening post-exposure prophylaxis. So we're making sure that we order all the resources we need to support these new programs so that we are ready to introduce that into the country once the various approvals are received.
Doc, in relation to TB, and you've talked about other associated diseases, which when a person becomes vulnerable, when they have HIV without the proper treatment, all these other issues that arise. Just in layman's terms, if you can tell our people of the dangers that exist when the immune system gets deficient.
Sure. So the immune system is the system in the body that fights off infections and fights off cancers and other diseases. Now, HIV directly impacts this immune system and it destroys it. And when it destroys it, your body isn't able to ward off or keep away infections or cancers. And as a result of that, we have people who become diagnosed with infections they would not normally have and cancers that they would not normally have if their immune system was, fit and running well. So because a number of people are not on treatment because they're unaware that they have HIV, or they're not on treatment, or they've dropped out of treatment, a number of people are coming into our hospital system with these infections and with these cancers. So this is something that we are trying to address with new models of care that we need to introduce into the country so that we can reduce the number of people who are not on treatment. So for us right now, that number is actually quite large. And we need to reduce this number so that for their own benefit, they are able to become healthy. I think what we haven't talked about so far is that treatment is actually a form of prevention. Anyone that's on treatment and their virus is suppressed, they aren't able to transmit HIV to other people. So we want as many people who are HIV infected to be on treatment and be successful with treatment so their virus is fully suppressed. Full viral suppression allows us to prevent onwards transmission in our community, and that's something that Taskforce is really serious about addressing.
So a person may not die from HIV, can die from TB.
That's right.
Have you started getting stats along those lines as well?
Yes. Unfortunately, we've had a number of people dying, a number of adults and some children dying from TB and HIV. I don't have the exact stats on hand, but the cases are increasing, yes.
And beyond medicine, counseling, nutrition, mental health, all these issues, what's missing in our care system for those living with HIV?
Yeah. So psychosocial support is needed for any human being, that's whether they're sick or not sick. We live full experiences as human beings, and sometimes we need additional support. That's not any different for somebody living with HIV. Unfortunately, the demands on the system are so large that there aren't enough people with counseling skills available to us to make sure people living with HIV have access to psychosocial support. And it's something that the task force is serious about. We want to make sure that we increase the number of counselors that are available in all the hub centers, so the treatment clinics around the country. Right now, there are no establishments in any of these clinics. So the goal is to have at least 5 counselors in Suva, 3 in the west and 3 in the north. We also want to introduce what we call peer counselors. So anyone living with HIV is providing direct peer-to-peer, psychosocial support to one of their own peers. So we will be increasing the availability of HIV advocates. So these are people who are adequately trained to provide psychosocial support or advocacy to one of their own peers who are living with HIV. And that's something we will be introducing as well.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break. Had a major drug bust, and you would remember you would have been part of the operations at Laudala Beach. A lot of people in Fiji did not know what was methamphetamine. And what we are picking up on, people are saying it's readily available. Just the issue in relation to General Secretary, was that a tactical move that he ejected himself from Parliament?
Personally, it's unfortunate.
How are you dealing with those police officers who may be allegedly involved in this?
No one is above the law.
We assure you that we will be having police officers around.
As a result of that bad policy, by the end of this month, we would have lost close to about $70 million in government revenue.
Bula Vinaka, I'm Vijay Narayan. This is Fiji Village Straight Talk. Welcome back. You're watching Fiji Village Straight Talk. I'm Vijay Narayan. Our guest tonight is Dr. Jason Mitchell. Dr. Mitchell, before the break, we've had a lot of discussions about the risky behavior. Now, going back to the 1990s, that's when in the early 90s, I was in high school, and moving on from there, a lot of awareness campaigns about HIV at the time. And back then, there were posters, there were radio and television ads, school programs, everywhere. And it had gone quiet for a number of years, which may be another issue why we can see more increased unplanned pregnancies, teenage pregnancies, unprotected sex. We're not saying that it wasn't happening back then, but the campaign was in your face to remind you. What is the plan for this, as this is absolutely critical?
Yeah, Vijay, you're right. I was in school around that time, and then I entered university. And you're right, there was a lot of campaigns around HIV and STIs. And in fact, when I first started working in HIV, all the funding that was supporting a lot of these initiatives was really to support STIs, because this region has some of the world's highest rates of sexually transmitted infections, and HIV just wasn't even on our radar. But because there was so much resources around, people kept talking about how Fiji and other Pacific Island countries would be like PNG. And so, of course, all our donors came on board, and there was a lot of resources, the kind of resources that we can only dream about in HIV now, because all our donor partners put in significant amount. I'm talking in a multitude of millions of dollars. And that's why there was so much coverage. And there was so much coverage on all these awareness campaigns, and all the evidence that looked at those evaluations showed that they didn't work. So what has changed is a change in risky behavior in our populations, and the ongoing psychosocial or what we call social determinants that underpin leading to risky behavior and leading to vulnerabilities to infections. That has increased significantly. And a lot of it has to do with the absence of sufficient programming at the community level, but also, the absence of awareness at the magnitude that you talked about. There's been no evidence anywhere in the world that sort of investment makes much difference, other than people being aware. The evidence that was done evaluating these programs in the past showed that it didn't change in behavior, which is essentially what is required. Knowledge, which comes from these awareness campaigns, must result in a change in practice for people. So right now, what we do know is that there are new risk factors in our population, and we've already talked about that, and that's the risky behavior that's associated with drug use. What is missing from Fiji right now is a program that will reduce those infections in people who inject drugs. And that's what we need to introduce through the task force. So effective harm reduction programs, rehabilitation programs for people who don't want to be on drugs anymore, all those interventions are essential to addressing the HIV situation that we're experiencing right now. And as you pointed out, historically, we have had large campaigns that talked about all the things that we can do to reduce our risk of transmission through sexual transmission as well. Historically, that was the most common mode of transmission. It is still 50% of our infections are still as a result of sexual transmission. And that happens because of risky behavior associated with sexual practices. And for us, we know that the safest way for us to reduce our risk of sexual transmission of HIV is to use condoms consistently. We in this region have not been ever good at condom use, ever. There's been no documentation of good condom use in the Pacific. Nothing we have done in the past has improved that. Nothing we are doing currently will improve that. So one of the things we need to be looking at is our condom programming. We not only need to be looking at the increase in availability of condoms, we need to be careful about how we approach making sure that there's additional types of condoms that our population might want. Flavored condoms, for example, different sizes, for example. Communities have told us this, and we're trying to make sure that the program introduces alternative types of condoms. Also, just because you're aware that you need to use condoms and that you have the condoms in your hand does not mean people are actually going to use the condoms. And this is where all that social determinants has an impact on whether somebody actually uses the condom. We know that a lot of people in relationships cannot negotiate the use of condoms. They might have the condom in their hand, but if their partner is refusing to use the condom, what are we going to do about that? And that's something we need to figure out, and we don't have the answers for that. There's a lot of issues around gender-based violence, there's a lot of issues against intimate partner violence, and all of that leads to risky behavior. We have to address all of that. And so it's not simply a case of doing more awareness. We have to address all the underlying things that leads people to be more vulnerable to HIV and STIs and other bloodborne viruses. Until we do that, we are not going to get on top of this epidemic. And this is something that, through the task force, we must be as strategic and comprehensive as we can be, which will be the same with our awareness campaigns. And as I shared with you, we wanted to be more strategic about this. And so there's going to be a technical working group that will be set up in partnership with people who work in the media, such as yourselves, to look at how we can be very strategic at targeting our messages to the right people in the right places. And a lot of the times, general awareness works for people in terms of increasing awareness, but sometimes we need to be really talking about the risks that certain people are involved with and reduce that risk in some shape or form. So there's a lot of work ahead of us, but we're excited. We're excited that the partnerships around us, such as with your organization and the media more broadly, people really want to help, and I think that's a win for us in the task force, and that's something we want to build on moving forward.
And we're ready to assist you in any way, because this is a fight for Fiji to ensure we do this right for the people of Fiji. You talked about we cannot come to a point where people accept that it is better to use condoms to protect me from getting HIV.
Yeah.
Why is it so hard? Are there studies done? Because we know negotiation with partners is hard. We've heard of women getting assaulted if they say, no, I won't have sex until we use a condom, etc., because of the dangers that exist. Even they get assaulted, then mistreated, saying this is not natural if you are telling me to use a condom. What can be done in relation to that? Have any studies been done that can get a better outcome?
Yeah. The studies that have been done in Fiji have focused on whether people use condoms and whether they use them consistently. The most recent study was in 2021, and that was done for the general population. General population basically means heterosexual population. Condom use is just over 20%, and consistent condom use is extremely low. We don't actually know what it will take to get to a point where people are able to negotiate the use of safer sexual practices, which includes using condoms. There's a lot of issues that we need to understand about condoms, and there needs to be studies to understand this. And unfortunately, as far as I'm aware, there's nothing in the pipeline. And it's something that we need to ask people who do research to look into this, because we actually don't know the answers to this. We do know that as a result of drug use, whether it's intravenous or oral use of illicit drugs, that people's ability to use condoms reduces significantly. That's a global fact. And it's something that we need to grapple with, because there are other practices that we are trying to understand, such as chemsex, which is where people use a drug along with sex, and that significantly reduces people's use of condoms. And as a result of chemsex, people are having sex for longer periods of time, which means it increases the risk of exposure. We also know that it means that people are having sex with large numbers of people, and this can go on for hours to days. That increases people's risk of HIV significantly. I'm sharing this with you because it's not as simple as you think, that it's just about giving more condoms or negotiating safer. There are other factors that we need to deal with, and that, somebody that's on drugs is just simply not able to negotiate condoms in the discussions in sex. Also, they may not even want to. And so this is something that we need to figure out, and I don't have the answers for that. We can certainly look at the experiences of other countries, but that's appropriate for those countries. We need to get the evidence from Fiji, and we need to make sure that it's culturally appropriate in our responses, and that's something we have to work on.
We had a show here, I think last year, where there was some discussion about even like families overnight, just a professional, a man who went out just clubbing on a particular night, had a one-night stand with a woman after a couple of drinks at the nightclub, has a wife and kids, and then tests positive for HIV. I'm talking about that, the lack of understanding or not wanting to understand, resulting in this, the family changing forever. And the discussion that took place was how the family had to grapple with this whole thing that they thought they would never face. If you can talk about, definitely it's happening more in the country now.
It's not something new. It's not something that's unique to Fiji. In fact, it's a global thing where you have families that are impacted by a HIV infection, and oftentimes it requires just one mistake, if you like, that leads to somebody becoming infected with HIV. We're seeing from Fiji, from the data, that people have used drugs just one time, and because they're sharing needles and syringes, and because they're injecting in groups, they get infected just one time. And scenarios like that, it immediately impacts the family. It's not something that we have the ability to address. Like what happens within families is hard for us to intervene there. But with enough information, with enough skills building, with enough behavior change interventions, with biological interventions such as PrEP and needle and syringe programs, we can address a number of that. But when it comes to things that are beyond an individual, this is where the awareness campaigns and having conversations in the broader media is important, because we need to be able to start having these difficult conversations within our families, talking about sex and being realistic about what partners are doing when they're not at home. Again, you've raised this issue about intimate partner violence, and it's difficult for us to have these conversations because of the risk of violence. And until we get to a point where we're addressing violence and where people feel strong and supported and not at risk of violence, we're never going to be able to have these conversations that are required for us to have frank conversations about partners using condoms when they're outside the home. And that's something that will be very difficult for the unit or the task force to address. And it's something that is requiring a whole of society approach. And that's where I think a multi-sectoral approach comes in. And that is something that is important as part of the task force, that we are working right across the sectors to make sure that we are all speaking the same language and we're trying to address this as a community. Because that's how we will be successful with addressing HIV, is in a community-led response.
And Dr. Mitchell, to battle injectable drugs, we know that that risky behavior is resulting in more. What is the percentage from injectable drugs in new cases?
For those who have come into our clinics, it's about 48%.
48%?
Yes, so almost 50% of those who are becoming infected with HIV now is associated with high-risk drug use.
How are you dealing with the needle program to ensure there is no sharing of needles?
Okay. As you know, there's no formal needle and syringe program here in Fiji, and the government has made a serious commitment to introducing it as soon as possible. So our task force is going through the motions of drafting cabinet papers in which our minister can take to cabinet to get approvals for the introduction of a needle and syringe program. There needs to be a lot of groundwork because it's a new program to Fiji. People think it's just about distributing needles and syringes. It's actually more complex than that. It's about understanding the drug users themselves. It's about understanding their needs. It's about understanding the way that we should be distributing it. We need to understand the types of needle and syringes that should be distributed, how we're going to be disposing of these needles and syringes, what is the education program around all of that. There's a lot of work that needs to go into this. So I think it's important for us to reflect that there's a lot of support for needle and syringe programs. If we were talking last week, I wouldn't be able to tell you that the police were supportive of a needle and syringe program. I've met with the police commissioner this week. His team at the senior level are very supportive of a needle and syringe program, which is so essential for an effective public health program, because the police are essential allies to an effective harm reduction program. And one element of a harm reduction program is a needle and syringe program. So we need to work very closely with the police to be effective in our needle and syringe program. So we are excited that the government is supportive. We're excited that all our partners are supportive of a needle and syringe program. So we're hoping that come January next year, a needle and syringe program will be underway in Fiji.
And what role should churches, schools, workplaces and community leaders play in first of all, fighting HIV, making sure that more is done from even families, as you said, more talk everywhere in relation to everyone working to try to control the increase of HIV and also fighting stigma and discrimination against those who have HIV?
Yeah. I think for all those groups that you've mentioned, an underpinning approach is to approach this with compassion, with love and with understanding. And it's things that we as Fijians hold dear to our hearts, and it's something that we do on a daily basis. But a lot of the times people approach this with unkindness and cruelty, and it's because there's a lot of judgment and a lot of discriminations about who is being impacted with HIV. So as a community, right across the board, we all need to be approaching this with compassion, understanding and kindness. And it's important for all the groups that you've mentioned to be making it their business to understand who is being impacted with HIV, why they're being impacted with HIV, and how they are part of the problem and how they can become now part of the solution. Oftentimes we talk about the church. What's the church's role in this? The church is an essential, not the church, but the faith-based organizations are an essential part of this response. They have a wide audience. From the pulpit, they should be denouncing unkindness and cruelty. They should be setting the record straight about information. They should be approaching HIV from a position of understanding, trying to understand who it is impacting and what their role can be in the response. Churches around the world are part of many of our HIV responses, including needle and syringe programs. So everyone can play a role in a needle and syringe program if they choose to. Schools, the Ministry of Education has been real leaders in this. They have asked for us to make sure that needle and syringe programs or the risk associated with drug use is effectively covered in the curriculum, that it is addressed in family life education. We are hoping that the Ministry of Education will introduce comprehensive sexuality education. So that's the role the education sector can play in this. Also, in days to come, we will see children who will be HIV because of the situation we're facing. Many children will be HIV positive and attending school. We cannot afford to have children who are treated badly because of their HIV status. So we want the schools to play a part in this, creating environments where people feel welcomed, supported and cared for, and schools have a role there. At the broader community, all of us will know someone very soon who is HIV positive. It'll be your partner, it'll be your parent, it'll be your brother, your sister, a cousin or a friend. The situation is so large now that all of us will know someone living with HIV. It would be impossible for us to live peacefully together as a community if we have the current situation where people are treated badly because of their status. And so we want to see that communities are bolstering or surrounding people living with HIV and the communities that are impacted with HIV, because we all have a role to play in the HIV response. And we hope that people reach out to us to see how they can play a part as from their sector in the HIV response.
Dr. Mitchell, you've got a mammoth task at hand for you and for us as a country. As you speak about it, the statistics do not look good. I mean, it continues to rise. We can see the risky behavior continues to increase. We continue to cover that, and we can see that there's a lot of work that needs to be done. Looking at where we are right now, are you confident Fiji can still turn it around? Or are we already on the brink of losing control of this epidemic?
No, everything is within our control right now. And I say this because there's enough resources, there are enough people who have paid attention to the issue, who have committed themselves and resources, both human and financial resources, to looking at strategies that we can introduce. As I've shared with you, in a matter of months, the government has come on board with support for interventions which most governments would resist for many years before they finally agree to it, such as a needle and syringe program, such as PrEP, pre-exposure prophylaxis. All these interventions are fully supported by our government, and that's a big win for us. So what we need to do is continue this momentum that we have started, making sure that we continue to invest in the HIV response and all the other diseases that are associated with it, and making sure that we are strategic in what we do. And with all of that and all the support we are getting from both our partners in Fiji and outside of Fiji and our community around us, we will be able to turn this around. We've done so for every type of infectious disease that has hit Fiji in the past, and we will do it again.
Doc, you have a captive audience watching this around Fiji and around the world. Fijians are definitely interested in what's happening, and thank you very much for giving out all that information on the real situation on the ground. As we finish off tonight's show, what's your message to the Fijians watching this around the world?
Thank you, Vijay. I think it's important that all of us recognize that we all have an individual responsibility for ourselves, also within our families and with the community at large. HIV is an issue now that potentially impacts all of us, as I've shared with you. So I think it starts in the home. It starts with at our own individual level. I think all of us, from our places of work, within our smaller communities, we all have a role to play. And I think it's about asking the questions about what we can do and how we can make the difference for ourselves and for others around us. And I think that's probably the best way I could leave this discussion. Because I do think that it's important to reflect that this is not easy. It is a complex issue with lots of connected parts, but I think we can all start with ourselves and take it from there.
Thank you, Dr. Jason Mitchell, that's chairperson of Fiji's National HIV Outbreak and Cluster Response Taskforce. A lot of work lies ahead, and definitely he will be back after this show in the coming months as we will continue to focus on the developments and the situation at hand. Until next week, have a great evening.
Thanks.
Thank you, greatly appreciated.